Hello, my name is Theresa Patton, and today I'll be presenting findings from my dissertation, completed in May of 2025, examining the effects of health insurance premium types on preventive care utilization among Black and white women in Louisiana and Mississippi. This research examines how affordability, as reflected in insurance type, influences the use of preventive care services. Preventive care services improve health outcomes, yet utilization remains low nationwide. Although the goal was set at 11.5% recommended high priority preventive services utilization, the actual rate fell to 5.3%. Health insurance plays a critical role in access to preventive services, and while the Affordable Care Act removed many financial barriers, racial and economic disparities persist. This study focuses on Louisiana and Mississippi due to their contrasting Medicaid expansion policies in neighboring states. The ACA mandated no-cost preventive services and expanded Medicaid eligibility, yet awareness and utilization remain uneven. Only about half of Black women report awareness of no-cost preventive services, and millions remain in the coverage gap. This reinforces the idea that access does not always translate into utilization. As of this study, 10 states still have not expanded Medicaid coverage, leaving nearly 3 million people in the coverage gap, making too much to qualify for Medicaid and too little to qualify for the exchange. The purpose of this study, it's a quantitative study to determine whether insurance type as a proxy for affordability influenced the utilization of preventive care services among Black and white women in Louisiana and Mississippi. This study used a quantitative cross-sectional design with data from a large state-level national data set, the Behavioral Risk Factor Surveillance System, BRFSS. The sample included over 4,000 Black and white women aged 18 and over living in Louisiana or Mississippi. Binary logistic regression was used to assess the relationship between insurance type and recent wellness visits within the last 12 months. The results from question 2 of my dissertation show that Black women were significantly more likely than white women to have had a wellness visit in the past 12 months. This finding suggests that expanded coverage, particularly through Medicaid, may be helping to reduce racial disparities in preventive care utilization, which is contrary to traditional expectations. Not on question 4. No significant differences were found in the relationship between insurance type and preventive care utilization between Louisiana and Mississippi. While Medicaid expansion increased coverage, it did not result in higher utilization rates across states, highlighting the persistence of non-financial barriers to care. In conclusion, preventive care matters, insurance type matters, and in this study, race matters. While policy changes have improved coverage, affordability alone does not guarantee utilization. As this study shows, free isn't always free.